Hi, I'm Dr. Javad Sajan. I'm a cosmetic plastic surgeon. Scar Protocol is a system that I developed to help my patients minimize scarring and heal after surgery. I saw many of my patients would go and buy different creams from different sources that would actually harm their healing, and people will get worse scarring, redder scars, thicker scars, and darker scars. After using many creams and different treatments on scars, I realized some things worked much better than others. One cream does not treat the life cycle of a scar. We have a phase for each phase of healing. Consists of 5 creams and a special wash. And each phase of Scar Protocol treats the scar during its specific life cycle to minimize it, to help it heal, to promote it heal, and to help you get the best possible results. Scar Protocol is meant to be started within 6 months of the scar. That could mean either when you had the injury and you start using it within 6 months, or within 6 months of having the surgical scar. Phase 1 consists of a wash and a cream. You're going to utilize this for the first 30 days. Phase 1 helps moisturize and promotes epithelialization of the wound. What that means is it helps the skin heal and promotes the skin growing. Phase 1 is used for 30 days and it gets it ready for the next phase, which is phase 2. After you're done using phase 1 for approximately a month, then you're going to move on to phase 2. Phase 2 is really important because it provides essential nutrients to the scar and it helps prevent overhealing. What overhealing can lead to is either a hypertrophic scar or a keloid. Those are basically those thick scars. A hypertrophic scar is a thick scar that stays within the wound, but a keloid is a scar that grows outside the wound. And phase 2 is designed to promote healing, but to also help prevent the hypertrophic or keloid scar. After utilizing phase 2 for 2 months, you're going to advance to phase 3. Phase 3 is designed to help promote collagen production, which will help give wound strength, and it helps restore the damaged cells. Phase 3 is also designed to help with color correction. What this means is we want the scar to match the surrounding complexion. Our goal is to prevent hyperpigmentation, a dark scar, or to prevent hypopigmentation. And hypopigmentation is where the scar is light and the melanocytes didn't give you the correct color. Phase 3, by helping promote collagen production, it helps the wound get back to close to its original strength. After finishing phase 3, you're going to start phase 4. Phase 4 helps blend the scar with the rest of your skin in its thickness. It's designed to help break down irregularities and help it be on the same level as the rest of your scar. It does this by helping break down the scar so it's even with the rest of your skin. Next, after phase 4, you'll be starting phase 5. Phase 5 is a retinol-based cream. What that means is it increases the turnover of cells. That helps shed the old skin from the scar and helps your body form new skin to create a scar that is normal with the surrounding tissue and skin. Scar Protocol has made a tremendous impact in the lives of my patients. I developed a system to help give people a way to treat their scar proactively, that's safe, doesn't give them significant risk, and a system that helps optimize the incision, the wound, the scar to give them the best possible result. Scar Protocol was created because of a need to help give our patients the best possible result that's low risk, safe, and something that really works and helps.